Okay, so you sent me some questions in advance, and I'm very pleased to answer these. Firstly, you asked me, what can you tell us about Greek doctors and patients using social media? Looking at Creation Pinpoint, the volume of healthcare professionals in Greece who are active in social media is relatively low compared with, say, another European country like Spain, where we've got several thousand healthcare professionals in the system. In Greece, we've got more like 100 or so currently within Creation Pinpoint, but it's growing all the time. And of those healthcare professionals in Greece that are using social media, public social media channels, they include primary care physicians, they include specialists, surgeons, nurses, and pharmacists. And most of their tweets are in English language, which to me reflects a desire that we do see across European countries to connect internationally. Although there are, of course, some local language tweets, so we do see some tweets in Greek language. And of course, in terms of patients, there are many, many more patients who are active in social media. And we see this everywhere. Patients have really led the way in terms of using social media to engage with each other and with other health stakeholders. So the next question you asked me was, in Southern Europe, the use of social media in healthcare lags behind Northern Europe. How could this be improved? And why should a healthcare provider invest in social media? Great questions. So how do we accelerate the use of new channels in any region to improve healthcare? I think the answer has to be we keep sharing stories of what is working well. We keep being open and honest about the challenges, but also showing really what can be done. It's really about, the kind of thing that's happening here at this event is a great example of that. And why should a healthcare provider invest in social media? I think really the question is, should a healthcare provider invest in two-way communication, or what we call engagement? If you believe that communication is a good thing, and especially two-way communication, so, that means listening to health stakeholders like patients, doctors, policymakers, and responding to them. If you believe that's a good thing, then social media is an environment like no other where you can carry out this kind of engagement. And it's highly cost effective. When it's done well, it's more transparent than traditional one-way communications or advertising. So you asked me, what are the biggest obstacles for the use of social media by healthcare providers? This move towards two-way dialogue or engagement has really changed the paradigms, the way we see health communication. For some, it is just simply uncomfortable for them to think in terms of an environment where people are encouraged to participate in two-way public dialogue. And working with social media, where communication happens faster and often includes many more people, also disrupts traditional working practices. For some providers, to embrace social media means really changing the way that they work, even internally as a team together. So we often see people quoting areas like regulation, regulatory compliance, or technology as the barriers that prevent their organization from embracing social media. But really, I would suggest it is all about people. Can we really work together to make it happen? You asked me which areas of healthcare have seen so far the highest impact from the use of social media. One of the amazing things about social media is how it connects together like-minded groups of people anywhere in the world. So in healthcare, this really started some years ago with patients connecting together to form communities. And the opportunity for patients, especially those living with a particular chronic condition, to connect together, to learn from each other and become empowered through that, was the first big achievement. And now, as we've seen, this has spread to healthcare professionals too. The next question was, the search for health information on the internet showed a 27% increase in 2011. What are your estimates for mhealth growth in Southern Europe, and will the economic crisis delay it? mhealth, the concept of accessing health information or tools using a mobile device, certainly continues to be a huge growth area. Will the economic crisis delay it? I think that in a time of austerity, people are turning to their mobile devices often before adopting other technology or technologies. So I predict that when we look back at this era, it will be one where the mobile device really did become the first port of call for health matters. And you asked me for my estimates of the future trends of social media in healthcare. Great question. I think that the lines will continue to be blurred between what we call social media, mhealth, digital, and other kinds of emerging channels. I think that patients and health consumers, that is all of us, have tasted what it's like to learn from others, to take the initiative with health information, and to take part in two-way engagement. Did you know that the World Health Organization announced just last week that it would be sending out global updates on the H7N9 virus via Twitter first, and then afterwards updating the information on its website? I think that it's inevitable that we will continue to participate in healthcare engagement using whatever channels emerge in the years to come. And this will mean better health and better outcomes.